Today, we are going to look at a BodyViz brain builder about mammary glands and mastitis. The CDC indicates that slightly over 83% of infants were breastfed for at least the first 6 months of their lives in 2020 and 2021. The CDC also indicates that approximately 10% of breastfeeding mothers develop mastitis, an uncomfortable and often painful inflammation of the breast. In the typical adult female, most of the central portion of the mammary gland overlies the pectoralis major and the serratus anterior muscles of the thoracic wall. A layer of deep fascia separates these muscles from the superficial glandular tissue of the mammary gland. Mammary glands are modified sweat glands of the integument. These glands are composed of secretory lobules and their associated ducts. These secretory ducts converge to form somewhere between 15 and 20 lactiferous ducts. All of these lactiferous ducts open independently at the nipple of the breast. The circle of pigmented skin surrounding the nipple is the areola. In a non-lactating female, the primary component of the breast is adipose tissue. Changes in hormonal levels during pregnancy significantly alter the internal anatomy of the female breast almost immediately. With the onset of pregnancy, blood flow to and fluid retention within the breast increases significantly, often causing sensitivity to touch, swelling, and soreness. At approximately 6 to 8 weeks of pregnancy, the breasts will increase in size. As they increase in size, soreness and sensitivity may also increase. The nipple and areola may become darker in color, which is due to the increased blood flow to the breasts. At approximately the 3rd or 4th month pregnant, females may experience small bumps on the areola, increased size and extension of the nipples, a larger areolar circumference, and colostrum leaking from the nipple. Colostrum, also termed pre-milk, is a thick, yellowish substance. It is worth noting that colostrum may occur later in some females, or never. As a pregnant female nears the delivery date, the composition of the colostrum typically changes from a thick and colored substance to a less dense fluid that is much paler in color. Next, we will look at the symptoms, causes, and treatments for mastitis, and then, finally, give a patient example. Symptoms of mastitis can occur suddenly. The breast will swell and become tender and warm to the touch. The skin may redden, and a wedge-shaped pattern or coloration may appear. The breast may also appear to be thicker, and a lump may be noticed within the breast. Pain and/or a burning sensation might be felt by the mother while breastfeeding. Additionally, a fever above 101 degrees is not uncommon. The cause of these symptoms is trapped milk within the breast. Milk can become trapped due to a clogged secretory or lactiferous duct. Another potential cause of mastitis is the introduction of bacteria into the breast through the nipple. Most often, the bacteria stems from the baby's mouth or the skin of the female displaying symptoms. Treatment of mastitis will typically involve prescription antibiotics and pain relievers. Most of the time, it is still safe for both the female and newborn to continue breastfeeding. A physician may refer the female to a lactation consultant to adjust breastfeeding techniques to prevent another case of mastitis. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 32. Sex, female. Chief complaints, tender, warm, swollen left breast, and a fever. You invite the patient into your office for an examination. Your patient informs you that she has been breastfeeding her baby for the past 3 weeks and has noticed that her left breast suddenly became tender and warm to the touch. She has also started experiencing pain and discomfort when she tries to breastfeed. You perform a physical examination and confirm that your patient has mastitis. You prescribe her antibiotics to clear the infection and advise her to take ibuprofen for pain relief. You also recommend that she continue to breastfeed or pump milk regularly to help alleviate the blockage. Your patient follows your recommendations. In addition to your recommendations, your patient adjusts her breastfeeding technique to ensure her baby is latched on properly. She has also started making a more conscious effort to have better hygiene and wear bras that fit properly. After a few days, your patient's symptoms start to improve. After a little over a week, she feels nearly back to normal. This is a classic example of mastitis. Thank you for watching this brain builder video. Please like and subscribe to our BodyViz channel, or if you are new at BodyViz, check out our other anatomy resources and schedule a demo at bodyviz.com.